Today we will be discussing bones, including bone growth, fracture repair, and the effects of aging. We will first speak about bone growth with specialist Jessica. How could a physician determine whether a person had reached full height by examining x-rays of the person's bones?
At maturity, the rate of epiphyseal cartilage production slows and the rate of osteoblast activity accelerates. As a result, the epiphyseal plate continues to narrow until it ultimately disappears and the growth completely stops.
How does bone grow in width?
In growing bone, we find osteoblasts on the periosteal side adding bone and osteoclasts on the endosteal side removing some bone tissue. To make a bone thicker, just add new bone tissue to the outside as if you were to take a pipe and add layer after layer of duct tape to it.
We will now speak with specialist Zoe about regulating blood calcium levels. How does the body turn vitamin D3 into calcitriol?
There are three steps of the activation of vitamin D to calcitriol. First, ultraviolet light converts the precursor molecule in keratinocytes of the skin to vitamin D3, which is released into the blood. Vitamin D3 circulates through the blood. As it passes through the blood vessels of the liver, it is converted to calcidiol by liver enzymes when a hydroxyl group is added. Calcidiol circulates in the blood. As it passes through the blood vessels of the kidney, it is converted to calcitriol by the kidney enzymes. Calcitriol is the active form of vitamin D3.
How does calcitonin aid in regulating blood calcium levels?
Calcitonin is a hormone that aids in regulating blood calcium levels. Calcitonin is released from the thyroid gland in response to high blood calcium levels. Although the entire function of calcitonin is unclear, it is known that calcitonin primarily inhibits osteoclast activity. In addition, calcitonin stimulates the kidneys to increase the loss of calcium in the urine. The result is a reduction in blood calcium levels. Calcitonin seems to have the greatest effect on conditions where there is the greatest turnover of bone, such as in growing children. If high doses of calcitonin are administered, blood calcium levels decrease only temporarily. Thus, therapeutic injections of calcitonin cannot provide long-term decrease in blood calcium.
As a physiologist, I get asked questions all the time about why are women more likely to develop osteoporosis than men? Statistics show that every decade, women lose roughly more than their skeletal mass than men do. A significant percentage of older women and a smaller proportion of older men suffer from osteoporosis. Osteoporosis is a condition characterized by a reduction in bone mass sufficient to compromise normal function. Another question is always about how does age influence bone structure? First of all, the textile strength of bone decreases due to a reduced rate of protein synthesis by osteoblasts. Consequently, the relative amount of inorganic minerals in the bone matrix increases, and the bones of the skeleton become brittle and susceptible to fracture. Second, bone loses calcium and other minerals. The bones of the skeleton become thinner and weaker, resulting in insufficient ossification, a condition called osteopenia. Aging causes all people to become slightly osteopenic.
Lady O asks, what happened to my osteoblast?
Osteoporosis, meaning porous bones, is a disease that results in decreased bone mass and leads to weakened bones that are prone to fracture. The occurrence of osteoporosis is greatest among the elderly, and the severity is closely linked to both age and onset of menopause. Smoking is also a risk factor for osteoporosis. Postmenopausal women are at risk because 1. Women have less bone mass than men. 2. Women begin losing bone mass earlier and faster in life. And 3. Postmenopausal women no longer produce significant amounts of estrogen, which appears to help protect against osteoporosis by stimulating bone growth. As a result of osteoporosis, the incidence of fractures increases, most frequently in the wrist, hip, and vertebral column.
Another frequent question is how can osteoporosis be prevented? Well, young adults should maintain good nutrition and physical activity to ensure adequate bone density, thus allowing for the normal age related loss later in life. Calcium supplements with vitamin D can be taken to maintain bone health. There are medical treatments that slow the rate of bone loss and attempt to stimulate new bone growth. Medications called biphosphonates are prescribed to slow the progression of osteoporosis. These drugs work by interfering with osteoclast function and thus retarding the removal of bone during remodeling. Our next specialist is Peyton. And Peyton, what are the 4 basic steps in fracture repair?
A fracture hematoma forms. A bone fracture tears blood vessels inside the bone and within the peroneum, causing bleeding. This bleeding results in a fracture hematoma that forms from the clotted blood. A fibrocartilous callus forms. Regenerated blood capillaries infiltrate the fracture hematoma. First, the fracture hematoma is reorganized into an actively growing connective tissue, called apercallus. Fibroblasts within the procallus produce collagen fibers that help connect the broken ends of the bones. Chondroblasts in the newly growing connective tissue form a dense, regular connective tissue associated with the cartilage. Eventually, the procallus becomes a fibrocartilous soft callus. The fibrocartilous callus stage lasts at least 3 weeks. A hard bony callus forms. Within a week after the injury, osteoprogenitor cells in areas adjacent to the fibrocartilous callus become osteoblasts and produce trabecula of primary bone. The fibrocartilaginous callus is then replaced by this bone, which forms a hard, bony callus. The trabecula of the hard callus continues to grow and thicken for several months. The bone is remodeled. Remodeling is the final phase of fracture repair. The hard callus persists for at least 3 to 4 months as osteoclast removes excess bony material from both exterior and interior surfaces. Compact bone replaces primary bone. The fracture usually leaves a slight thickening of the bone as detected by X-ray. However, in some instances, healing occurs with no persistent, obvious thickening.
Thank you, Peyton. Now, can you explain the risk of bearing weight on a bone when the fibrocartilage callus is forming?
The chemical and metabolic reactions that produce the soft callus begin a few days after the bone is broken. Fibroblast cells that are present in the granulation tissue begin to form cartilage and fibrocartilage. This is a spongy material that fills the gap between the 2 fracture fragments, although it remains quite weak to external stress for around 6 weeks. For this reason, it is important that there is not too much movement on the fracture fragments. The orthopedic consultant will ensure that there isn't too much movement at the fracture site by doing repeat x-rays and making sure that the broken bone remains immobilized with a sling or a movable plastic cast.
We will now speak with Lady O in regards to her osteoblasts.
Hello, I am Lady O. Lady Osteopenia. That's right. Thank you, Group 7, for your information on the skeletal system, structure, and function. I really appreciate all that information about the osteoblast, the osteoclast, the osteocytes, and of course, I am ever so thankful to know that nutrition, exercise, especially those weight-bearing exercises, and sunlight aided me in not having a hip fracture or any kind of fracture after my fall the other day. So I'm really grateful. And for you young people out there, please make sure you do some weight bearing exercises, eat properly, and spend some time in the sun. 10 to 15 minutes a day should do it. Take care. Your bones will thank you.